Unit 1, Fundamentals of Pharmacology. Knowledge of basic information in several areas provides a foundation for the study of pharmacology. Drug categories are introduced along with applicable terminology. The nurse's responsibilities and roles, the nursing process, and legal and ethical issues associated with medication administration are discussed. Here are your objectives and your reading assignments. The nursing process overview related to pharmacology. It is a research-supported organizational framework for professional nursing practice. It ensures the delivery of thorough, individualized, and quality nursing care to patients. It requires critical thinking. It is ongoing and constantly evolving. There are 5 steps of the nursing process, which includes assessment, nursing diagnosis, planning, implementation, which includes patient education, and evaluation. During the assessment process, data is collected, so it involves data collection, review, and analysis of the data collected. There are different kinds of data. So one is subjective, and there's also objective. Subjective includes all spoken information shared by the patient. So that includes complaints or problems stated, such as feeling dizzy, having headache, feeling hot, and even emotions. Objective, on the other hand, it includes information that is available through senses. It's tangible, that can be seen, heard, felt, and smelled. This also includes information that can be found in the medical records, such as lab results, assessment findings, and measurable data such as age, height, and weight. So basically, objective data will include your past medical history, right? So if the patient has a history of high blood pressure or hypertension, hyperlipidemia, or high cholesterol. And it also includes medication history, which includes social history such as alcohol, tobacco, and caffeine use. Part of that data collection will include your medication profile. So what does that mean? So it includes all the medication the patient is taking. So either prescription, over-the-counter, vitamins, herbs, and supplements, compliance on those medications or lack of compliance or non-compliance, and you also want to know about their allergies and their reactions. So it's not enough to just ask for allergies. So when a patient states, let's say he or she is allergic to an antibiotic, then the next question would be, what kind of reaction do you get whenever you take that medication? Now, they don't always know, they can't always remember, but if they have that information, it's good to have that on file. After obtaining all the information that the nurses needs, next step would be formulating a human need assessment or statement or a problem list. So basically, the nurse formulates human need fulfillment or alterations, and it is used to develop plan of care and goals. So you're going to base your treatment goals based on that human needs statement. Sometimes you may hear the terminology nursing diagnosis. So this is basically replacing the nursing diagnosis. Human needs statement consists of 3 parts, which includes the patient's response to an illness or drug, identification of factors related to the response, and evidence that supports the accuracy of the human needs statement. An example would be acute pain. So that's the first part, right? That's the patient's response to an illness or drug. And then followed by related to, in this case, fractured wrist. So this is basically identification of a factor relating to that response. So what may be related to that response? So in this case is the fractured wrist. And it's followed by evidenced by grimacing, heart rate of 110, pain level of 10 out of 10, and so on. So this last part, as you can see, is the evidence that supports the accuracy of that human need. It's basically a proof that yes, the patient is in acute pain. The next step is planning. So this is the step wherein the nurse identifies patient-oriented outcome with specific time frames. So outcomes, what are those? So those are objective, measurable, and realistic with an established time period for their achievement. So this is basically your goal, right, for your patient. The ultimate aim of outcome identification pertinent to drug therapy right, or medication administration, is safe and effective administration of medications. The step is followed by implementation. Implementation is the initiation and completion of specific nursing actions as defined by the Human Needs Statement and Outcome Statement. So, implementation can be independent, collaborative, and dependent. An example of implementation would be administer acetaminophen 650 milligrams as ordered every 8 hours PRN for pain. So as you can see, this is addressing that human needs statement that we talked about earlier. Since we're talking about medication administration, let's talk about the 6 rights of medication administration. So your textbook is identifying 9 right now. However, for the purposes of this program and our course, we will be using 6 rights, as the additional 3 rights are somewhat of a given or obvious. So what are those 6 rights of medication administration? So you need to write those down. Right patient, right drug, right dose, right route, right time and frequency, so it needs to be complete, and lastly, right documentation, which includes patient education. As mentioned in your current textbook, the current practice standard suggests 3 additional rights. So the additional 3, which you're not going to be tested on, are the following: right reasons or indication, right to refuse, and right response. So you're responsible for knowing the 6 rights. Remember, you have to remember this, and most likely it's going to be part of your test. In addition to remembering the 6 rights of medication administration, you also have to remember the 3 medication checks or cross-checks of drugs. So the 3 times that you're going to be checking for those information, or for as many information as possible, in order to make sure that you are administering the drug safely. So there's 3 medication checks. The first one is on first contact when pulling the medication. The second is preparing or opening the medication. So as you're preparing and opening that medication, you're verifying again that you actually have the right drug, this is for the right patient, and so on. Lastly, when you're right there with the patient, right prior to administration, you check that medication again to ensure that you still have the right drug, the right dose, and so on. Again, you have to remember the 3 medication checks. When administering medications, there are some instances or circumstances wherein you're required to have another licensed person co-sign the medication that you're given. So sometimes you'll hear the term double check, cross check, or co-sign. And oftentimes it happens right before administration, or there are facilities that will require you to do that right when the medication is taken out of the Pyxis or the machine where they store the medication. But anyhow, so there are different circumstances where they require those a double check or a co-sign. But most commonly, you have to remember this, a second licensed personnel is required to co-sign when you're giving the following medications. One would be when giving heparin drip, insulin, PCA or patient-controlled analgesia, thrombolytic, and chemotherapy. Again, when you're giving these medications, oftentimes you are required to co-sign or have somebody co-sign with you. These are the heparin, insulin, patient-controlled analgesia or PCA, thrombolytics, and chemotherapy. What you have to remember though, some facilities will have a slight variation of that. Some facilities, when giving heparin, for example, they don't require the double check unless it's a heparin drip or an IV form of heparin. And same thing with insulin. So insulin, we used to co-sign insulin every time we give it, regardless of the route that we're giving. But nowadays, lately, a lot of the facilities or hospitals are only requiring co-sign when you're giving insulin through an IV or when it's an insulin drip. So you'll see that some nurses will just administer insulin sub-Q without a co-sign. Now, for the purposes of this class, medications that are cross-checked or co-signed with another licensed personnel will be heparin, insulin, PCA, thrombolytics, and chemotherapy. Now, some people would wonder, well, does that mean that every time I give a controlled substance such as a hydrocodone or a pain medication, do I need a cosign? No, you don't have to all the time. It's just for PCA or patient-controlled analgesia. Anyhow, so there are also, other than those ones that are required, that we're requiring you to co-sign, sometimes you may need somebody to co-sign or cross-check the medication when you're calculating a high alert medication, or a medication that when calculated wrong, that can cause severe adverse reaction to the patient, right? Sometimes if the drug strength or it's causing a high lethality, so even a slight increase in the dose, if that can kill a patient, obviously you may want to cross-check or double-check or co-sign it with another licensed person. Why is the 6 rights of medication administration and the 3 checks important for this course and for the program? Well, it's simple. It's basically because these 6 rights and 3 checks, they are intended to prevent medication errors. So for the most part, if you follow this, you check your 6 rights and you do your 3 checks, for the most part, this will prevent you from committing a medication error. As I mentioned earlier, part of implementation is patient education. So implementation is not always equivalent to administration of medication. Patient education is as important as other nursing interventions, and especially when you're administering medications. Most patients, if not all, want to know, what are you giving? Why are you giving that medication? Sometimes if they don't know what you're giving, they're going to be scared, and they will have a tendency to refuse that medication. And in addition to that, knowing about the medication, right? When you educate a patient, there is a higher likelihood of them being more compliant after their discharge home, because they know the importance of the medication. They know the possible benefits of taking the medication versus the risk of not taking those medications. That being said, when we're doing our patient education, there are a lot of things that we have to consider, because the way we educate a patient is not always the same with how we educate another patient, right? We have to consider, what's their age? Are there any barriers to learning? What's their cognitive ability? How about finances, right? So it doesn't matter if you're educating this patient, let's say, about this great medication that's very effective that you're giving in the hospital, but what if financially that patient cannot afford it? Will that patient be receptive of that education? Of course not. It's going to be basically a waste of time for that patient if you're talking about this medication that they can't even afford when they go home. These are additional considerations. Feel free to read it. But also, one thing to consider is readiness to learn, right? Are they ready to learn? You have to also time it correctly. An example of that is, let's say, a fetal demise, right? So if you have a pregnant mom who comes to the hospital, and to find out, the doctor just informed her that they lost the fetus or the baby, is that a good time to educate the patient? Of course not. It doesn't matter what you say at that time when they're grieving. They won't remember anything, and there's a possibility that they're even going to be upset at you for doing that. So you have to time it accordingly. And the last step of the nursing process is evaluation. So evaluation is ongoing part of the nursing process, right? So every time you do something, so after you've done all your steps, right, and then you implemented that plan, the next thing is you want to evaluate, did that intervention, right, when you gave that medication, was it effective? So that's part of your evaluation. And in addition to that, other than being effective, did the patient experience any side effect, any adverse effect? So this is ongoing. And basically, it helps you determine the status of your goals or outcomes. Are you meeting those outcomes that you set initially? Are you on the way of meeting those outcomes? Or you're basically far off and you're not even close to the outcome that you wanted? So evaluation basically includes monitoring the patient's response to the drug therapy, So that's both expected and unexpected responses. And also when you're evaluating, you also want to make sure that you're documenting that. And that documentation needs to be clear and concise. So an example of that, let's say the pain medication that we administered earlier, right? So after implementation, now it's time to evaluate. When you go back to the patient room, right? And then you determine that the medication administration, the medication was effective. You can't just state the medication is effective, the patient feels better. That's not enough. It needs to be more clear and more accurate. So you want to state after medication administration, when evaluated patient's response, then you want to say patient states that the pain level is now a 5 out of 10 compared to a 10 out of 10 earlier before the medication administration. And another thing that you would want to remember, the roles of the nurse as it relates to medication administration includes, there's 3: provider of care, manager of care, and member of the profession. Again, provider of care, manager of care, and member of the profession.